all my E.N.T doctors and E.N.T hospitals people, I would like to just give my small suggestions. The E.N.T field, I am there for the past 35 years as a biomedical person. I am Naresh from Vaansari, Chennai. Many doctors called me to know you have any gadgets or how to do OP in this COVID-19 situation. So I have given my suggestions to few E.N.T doctors which I would like to share through this video. I hope it will be very useful for you. Maybe some of the points may not be good, you just leave it. Whichever is good, you please take it. I felt myself in the situation, giving my ideas also will be of little use to the E.N.T professionals in the world. Number one, how to do OP. My suggestion is, I call today until this COVID-19 problem gets solved, the E.N.T OP should be called Zoo OP, Z-O-O-O-P, Zoo OP. What is Zoo OP? Patient coming directly from the reception to a glass room. You being a doctor will sit other room, plain glass room. With the mobile phone, let the patient explains you his problems and you will suggest him your prescription through WhatsApp prescription message. Why like that? Whether he will be happy. Number one. Today in India, many patients, for example, a patient is coming with a headache. First, he is not coming to a E.N.T doctor. First, he will go to a medical shop, take a headache medicine. Not okay. Then he will go to a cheap general practitioner nearby his home to take some medicine. Not okay. Then that E.N.T doctor is advised by the GP or himself coming to a E.N.T doctor. That is, first defense, medical shop. Second defense, GP. Third defense is only E.N.T. So, a patient who is coming to you as a third defense definitely will have a complication. He will come and sit in the glass room, isolated glass room where his mobile is on, your mobile is on, you will see him and he will see you. You suggest him a medicinal prescription through WhatsApp prescription to him. Let him put the money in the undi. I will come back in the last about the undi money, whether that money also will have infection, then I will tell you about it. Then he will go back. While going back, you can, as a very good human, give him some Ayurvedic drinks, human drinks to him that let him have in the first, or when he is going back, he can have with the satisfaction, let him go. No staff is involved, nobody is involved. Sterilization of that room, every patient, it is very difficult. If it is possible, very good. Otherwise, like a cinema interval, morning OP, 10 patients after one interval, another 10 patients, another interval is possible. They are not direct connected anyway with you or with the staffs. But that room, 3 regular intervals you can clear with the disinfection system. This is the first method. And once the medicine is having some help or it is not having any help, he will come with a major complication, then you can ask the patient to have COVID-19 regular testing and all the thing, surgery or any other additional things. Future, how the E.N.T is going to be the question. It is going to be like this. I have already developed through my German friend many days before to have a disposable endoscopic tip, a 0 degree and a 70 degree kind, where there will be a basic attachment fixed like a Dr. Mubarak's Khan stand, and it is covered with the total plastic disposable sheet. Only the pinpoint will be visible outside. The 0 degree tip first connected, patient can put it in the ear or in the nose, and 70 degree can be put it for the throat examination. This will take 3 months time. The basic items are getting ready. Next week I can show how it is going to be. And that way each patient has to throw the disposable. Today the disposable costs 3,000. Then the question will arise, 500 rupees for consultation itself difficult. How the patient will say 3,000. It is going to be like this. You have to convince the patient that first your glass room zoo consultation is only 500 rupees. As he is having complications, you can tell him you have to undergo endoscopic application. That is where he has to pay 3,000 extra. for whatever the examination you do, that 3000 cost will go for the endoscopic. Presently, we are working out the cost of the disposable endoscopes tips. I hope we can bring it maximum cheaper with the bulk quantity with the German people. This is the second stage, but this technology will take 3 months. But when all the E.N.T says okay, then I will start production. Until then, only zoo OP in the glass room. If it is a surgery case or a pre-examination OT endoscopy has to be taken care with the COVID-19 regular testing and protection and masking and so many like you are doing in the operation theatre. But as advised by the health authorities in the hospital operation theatre also, or patient sitting OP room also, don't put AC because AC water particle sucked from the outside fan. Even outside somebody sneeze, that sneeze is picked up by the AC outside and sprayed inside is a very difficult situation. Even though it is a summer, maximum avoid air condition when the OP level or you are sitting. If it is a centralized AC plant in the top, no problem. If it is only a regular AC with the fan outside, very, very careful. That fan area, nobody should go around, then it is safe. This is about the OP situation and pre-examination situation. When the operation cases found, then you can do regular COVID-19 test patient, and after the test, immediately the patient get admitted in the OT 1 day before. Means generally they come in the morning and get admitted. In this situation, 1 day before itself they should admit. After the test is, if the test is okay, positive, no negative, no problem for the patient. If the test is negative, patient is fit, then the same day admission. He will not be exposed to any other infection people, so that he will become a transmitter of the disease. Such much care, and you put your dresses for the staff and all these things, you can care, regular maximum care of OT you can do and do the surgery. And some yesterday AOI discussions about not to use debrider and micro drills, which makes the particles spray around you. Even this can be done, but when you are masking, covering and disinfectional things are very perfect, you can do that because you have already tested the patient COVID-19 not there and he is not exposed to next day. Maximum care has to be taken. So such a way OT can be also nicely done. And sterilization of each equipment has to be, like for example, your regular formalin sterilization will not work for HIV and this virus. That can clear only a minimal bacterial infections and kind of things. Formalin will not work. You have to use the special DuPont, it comes with BIP solutions where you dip for 20 minutes, the perfect sterilization. So please take care, maximum sterilization of endoscopes where you are using or any other equipment, or autoclaving, whatever possible. That much you have to take. Don't believe in your formalin tablet, formalin things. Formalin will not work out. Please maximum you use best solutions. Number 3. Number 4, somebody asked, undi money, the patient is putting notes. Even notes can carry the infection. What to do? And we are already in the last edges of making a ultraviolet radiation cash box, where that will be ready by next week. Very cheaper. You can put all your notes inside that, and it is the license and testing is going on. Once it is approved by the authority, then that machine can be kept in the hospital. All the notes collected in the hundi, not to touch, directly put in the UV box, and it can be disinfected. Then you take it. This way you can maximum save these people. So this is my humble request for the time being, so that you can be very safe. E.N.T practice cannot be stopped. All the private E.N.T practice can be started like this, except governmental setup. Governmental setup, it is very difficult because each glass boxes, one patient room and one doctor room is very difficult in the government OP situation. That government has to decide and do it. In some hospital setup, even I can suggest hospital outside ear, nose, throat or ophthalmic or a dentistry area, where you can have even patient can come inside the the tent, sterilization spraying tent, that is very cheaper nowadays available. You can keep it mobile sterilization tent. Patient will come through that, so that he is steriled and then coming inside. That much care you can do. That if it is a hospital setup, because that has to be purchased and you can make the setup, somebody has to maintain it. Otherwise, the best way is the zoo OP, glass room patient sitting and going back, and you will be sitting outside the other room, checking the patient initially at the third defense. If the third defense not working, Then the fourth defense is, like you are taking the patient to minor OT, you can do with all the system until we quickly get the disposable endoscope tips where patient can touch in the room and put it in the ear, put it in the nose, put it there and throw it in the dustbin, or you can take it out. Like that it is going to be. Such things are going on today's situation. So this is my humble suggestions of some points. I hope some small things are useful. I am not really a great man to explain all, but periodical phones and many people calling for this kind. This is the best solution presently available, sir. Thank you very much. Once the disposable endoscope is ready, next week I will just show how it works. Thank you, sir. Good day to all the E.N.T people around the world. Thank you. God bless everybody. Thank you, sir.